Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast interlude as part of the Amuscade and the Amuscade and Smash Up, and this audio podcast interlude as part of a Storm Robotics production. In this audio podcast, we're looking at some some differentiations between the sort of subtypes of juvenile myasthenia gravis and adult myasthenia gravis, and some elements of transient and neonatal myasthenia gravis, just to inform listeners and viewers. In There will be an audio. There will be there will be a look at some more detail of myasthenia gravis, sort of prospectively, and there have been some audio podcasts looking at some aspects, or there has been, sorry, a series. There have been a series in aspects of myasthenia, but as part of this audio podcast, there will be some additional aspects in looking at the sort of sub aspects of myasthenia gravis. So approximately 10 to 15% of myasthenia gravis cases have juvenile onset, or have a juvenile onset. That is to say, there are cases of myasthenia that are diagnosed as younger than that of 18 years of age, with a mean age of around 13 years of age, 13 years of age at onset, and around near 14 years of age at diagnoses. Juvenile myasthenia differs from adult myasthenia in as far as severity, gender ratio, and seropositivity rate, and probability of spontaneous remission. The race and pubertal development also influence myasthenia presentation and progression. For instance, excuse me, most uh, most Korean juvenile myasthenia gravis recipients present with pure and pure main sort of symptomologies, and whilst European and United States investigations report predominantly other in around other symptomologies in pre-pubertal onset and generalized disease post puberty, in context of myasthenia. In prepubertal juvenile myasthenia gravis, patients or recipients are more often seronegative and exhibit particular symptomologies, and show better response to particular sort of treatments or treatment modalities than post-pubertal recipients. Cholinesterase inhibitors, and corticosteroids serve as still serve as sort of the first line for pharmacotherapy treatments, and was whilst at the same time other pharmacotherapeutics have been used as second line for generalized or refractory sort of symptomologies. Intravenous immunoglobulin, or IVIG, and plasma exchange have also been have also been prescribed as sort of maintenance pharmacotherapeutics, and compared to juvenile myasthenia, adult myasthenia recipients tend to receive more combination, for example, combination pharmacotherapeutics, and particularly in around immunopharmacotherapeutics, but achieve lower remission rates. Although thymectomy, so thymectomy being a particular procedure, a particular procedure in around where the thymus, where elements of the thymus are thymus or thymus glands can be omitted in myasthenia diagnosed recipients, and this remains sort of controversial for particular for in around particular symptomologies of myasthenia of myasthenia. That is to say, listeners and viewers, that those who are diagnosed with myasthenia gravis formerly, the symptomologies are, for example, are not particularly universal, and therefore there is controversy or elements of controversy in context of the literature, around a thymectomy, around a thyrectomy, and in around particularly around in around a in around a particular in around particular cases or recipients of juvenile, or those of recipients being diagnosed with juvenile myasthenia gravis, and of those of juvenile myasthenia gravis recipients. But it is aware the procedure of thymectomy is or has retrospectively been the basis in around those with particular symptomologies of myasthenia, in myasthenia, and those recipients diagnosed in context of juvenile myasthenia versus adult myasthenia. And it is also considered for recipients, or thymectomy is also considered in recipients with, for example, where there's evidence of thymic abnormalities. Now, acetylcholine esterase also acetylcholine receptor, sort of antibody positivity, or poor response to particular pharmacotherapies also can prompt a basis of thymectomy.